Will, there's some things that have come up in what I've seen so far I just want to talk to you about. Your blood pressure looks higher than I'd like, and obviously that concerns me because there's some things that can happen with high blood pressure. And I got to point out that the smoking in combination with the blood pressure concerns me, and there may very well be cause and effect. I'm sure the last thing you need is somebody to nag you, but could we talk a bit about your smoking?
Yeah, sure. I'm comfortable with that.
Okay. So you smoked how long, Will?
Well, I'm 35. My first time I smoked was when I was 12 years old. It progressed as I got through high school, and I've been a regular smoker since about the age of 17.
Okay. So about half your life you've been a regular smoker.
Yep.
Okay. About how much a day, Will?
Well, it's kind of varied over that span of time, but I'd say right now I'm about half a pack a day.
Okay.
Yeah.
And the most important thing, I mean, I've got slides, Will, and statistics and all kinds of scary things I can say, but the most important thing from my perspective is what your thoughts are about your smoking. Where are you at with being a cigarette smoker?
Well, I am aware that it does have adverse health effects, and down the road I foresee me making a change in my behavior and knowing that the health consequences associated with smoking, but that day is not today. I don't feel like I really use, when it started off, as I mentioned, as a teen, it was more of a social thing.
Sure.
And acceptance. My friends were doing it. I got to college, I was open to more people who were smokers as well, and it seemed to be more accepted. And I've just been continue that use as an adult.
Yeah.
It's for me it's now become much more of a habit and just a routine as much as it is I feel like the nicotine and the effects of the cigarette itself. It's very much part of my daily routine.
Yeah. So this is part of your life. This is what you do.
Yeah, and I know it's the cost and have gotten increased over the last few years with the cigarettes, but like I said, at this point in time in my life, I have trouble seeing myself quit. I'm a little bit concerned about. I've had friends who've tried to quit as well. Some successful, some haven't been as successful. Ones that have quit, they've noticed they've gained a lot of weight. And that kind of concerns me in my age range as well.
Okay. So you're doing a lot of good thinking, Will. What I heard you say, and clearly you're a guy who's thought through some things about your health. What I heard you say is smoking has some negative consequences, and I don't want those things to happen. But today's not the day. I'm not going to sign up and say today I'll quit cold turkey. And I appreciate that. I would like to know, Will, more about what you know about potential negative consequences. When you think about what happens to smokers, even half a pack a day, what consequences are we concerned about?
Well, my grandfather had emphysema,
Sure.
Which was a direct cause of his smoking non-filtered cigarettes for 35 plus years.
Yeah.
That concerns me.
Yeah.
Shortness of breath. I notice. I still try to do some limited exercise, and sometimes that's very labor intensive for me when I'm exercising. That's a concern. The health of my family, my wife, being exposed to secondhand smoke is also a concern. We're looking at starting a family soon, and I know that behavior will need to change when that time comes. But I guess in terms of other health concerns, the more unpleasant ones, the complaints from my family members about the smell of me.
Yeah, it's hard. The social pressure is pretty rough.
And now, with different places and businesses outlawing, smoking inside restaurants and bars around our area, it's become much more of a challenge, maybe publicly, to smoke. So.
Yeah. So these real big health problems, some of which your grandpa had, emphysema, certainly lung cancer, another risk that people take. And then you look at what's going on in your own health. Already a little short of breath, sometimes not having the lung capacity that you'd like to have. Social pressure, exposing your wife. I wish I could say that's not a worry, but I think you're doing some good thinking. I do think part of why all this hassle about smoking publicly has happened is because if your wife's exposed, certainly as the two of you had children, if your children were exposed, there are some real health consequences to people who are around you when you're smoking. And already some sense of some symptoms you've had with your breathing. Are there any other, you mentioned breathing and people's negative reactions, your fear for your wife's health. Are there any other things that I should understand that you don't like about being a smoker? Other concerns?
You know, I mean, I guess in terms of my health, you know, my teeth, the yellowness of that, you know, the whitening of teeth and the appearance that I have, you know, I guess that's one thing on the surface that's of concern. You know, but really I think that the respiratory issues that we talked about, you know, the lung cancer, those are pretty much my primary big ones that I'm concerned with. But, you know, the routine that I have with smoking is so ingrained in my lifestyle that it's just really hard for me to fathom you know, stopping. You know, I've not really made a strong effort in the past to quit. You know, I've sampled some of the nicotine gum from friends who've tried it and didn't care for that. It was I found it, you know, not an equal replacement for the real thing. And I think that's kind of where I am.
Okay. So when you weigh things, you just say, man, I'm concerned about weight gain. This trick I know, the gum didn't seem so great. What else do you know, Will, about sort of small steps people could take who don't want to get emphysema or lung cancer or have this thing progress? Are there any small steps? You're telling me you're not ready to quit cold turkey.
Well, I think I mentioned at the beginning when we were talking, you know, the volume of the cigarettes I smoked has kind of varied over the years. There was a time in my early 20s where I was pushing close to a pack a day, and I think trying to reduce the amount is one, I guess, more tangible or realistic option in terms of reducing it. Rather than cold turkey, although I've kind of heard mixed messages that maybe cold turkey is the best way to go or not. So I'm not really clear on what would be the best strategy to apply.
Well, you've taken an important step, Will. One of the first things I say to people who say, I can't stop cold turkey, is could you consider cutting back? And that's a huge step. That is significant. It's not perfect, but I'm not in the business of perfect patients, Will. I'm in the business of people taking small steps, and this is a big one, and I want to congratulate you. I do know some things about other steps, Will, and even it sounds like quit cold turkey isn't a step today, but I do know some other options to lay out potentially. Would it be okay if you and I talk about those other options that you could just file away for when you're ready?
Sure, I'm always open to some suggestions and advice when it comes to this, so absolutely.
Great.